Good evening, and a very warm welcome to this year's annual members meeting. I'm Sue Musson, Chair of the Trust. Thank you very much for taking the time to join us for this important event. Our annual members meeting gives the Trust an opportunity each year to provide information on our performance, to demonstrate accountability to members, governors, stakeholders, and the public at large, and to look forward, setting out our priorities for the future. Our meeting this year is being held virtually for the second year running because of safety considerations linked to the pandemic, and specifically the high transmission rates present in the community. Our programme for the annual members meeting spans the following content. In a moment, I'll be introducing our lead governor, Andrew Moran, and our deputy lead governor, Doreen Schlechter, who will be presenting a report on the activity and achievements of the Council of Governors during the year. Normally, the Chief Executive would present the year in review, but this year, as our interim Chief Executive, Sir David Dalton, has only just recently joined us, I will be covering the look back on this year. I'll be paying tribute to all of our staff who have responded with immense courage, dedication, and resilience throughout the last year. Despite the intense pressures and challenges presented by the pandemic, our staff have been utterly fantastic. They've worked tirelessly to ensure safe and compassionate treatment for patients in our care. As part of our annual members meeting, we're required to present our annual accounts. This year, we've uploaded an animation detailing our financial performance to our website, which you'll be able to view along with our full annual accounts and annual report for 2020-21. The link to this page will also be sent to the chat box, which will be available later this evening during the meeting. And then back to our agenda. Looking ahead, Sir David will outline how we will continue to build on the sense of togetherness that we work so hard to foster as a trust, and we'll be communicating our priorities and areas of focus for the future. And then finally, we'll have a question and answer session with participation from our team of executive directors. Questions which have been submitted in advance of the meeting will be read out together with the answers. And should you have any questions that occur to you throughout the meeting, please feel free to note them using the live chat option on screen, which will be available shortly. We'll aim to respond to as many questions as possible during the meeting, and we'll capture any remaining questions and answers in the minutes of the meeting, which will be made publicly available. Just a reminder, as this is a public meeting, please may I ask that you do not include any confidential information relating to individuals in your question, as we wish to respect everyone's right to privacy. Thank you very much for that. To set the scene for our meeting, I wanted to just provide a brief outline of who we are and our story so far. Liverpool University Hospitals was created on the 1st of October 2019, following the merger of Aintree University Hospital and the Royal Liverpool and Broad Green University Hospital. The case for merger was clinically led and set out a compelling vision of the benefits to local people that could be achieved through the merger, including better access to services, as well as improved quality, outcomes, and sustainability for the healthcare services that we provide. Our merged trust is coming up for its second birthday and now employs nearly 13,000 staff, working across 4 main sites, Aintree, the Royal Liverpool, Broad Green, and the Dental Hospital, and working from several community-based sites. We are one of the NHS's largest trusts, with a turnover in excess of £1 billion per year. With our scale and size comes the opportunity for us to function as an anchor institution. This means we look to use our services, our role as a major employer, and our buying power responsibly to support the health and well-being of local people in the widest sense. We are a very large, complex and busy organisation, providing tens of thousands of care episodes every year. But each one of these encounters involves real people who matter, real people who have families and friends and loved ones. And although we have many responsibilities and obligations, it's so important that we keep in mind that every aspect of our work affects people, often at a time of great vulnerability. That's why we start every board meeting with a staff and/or a patient story that connects us to the experience of the people we serve. People like John and Maggie. Maggie initially raised a complaint about the experiences her family had before her father died in Aintree Hospital. The concerns she raised related to how John's relatives had been communicated with, access to visiting, and John's general care during his time in Aintree. Using Maggie's feedback, the Trust developed a range of improvement actions and invited Maggie to share her story across our Trust, including at the Trust board. The concerns she raised related to how John's relatives had been using Maggie's feedback, the Trust developed a range of improvement actions and invited Maggie to share her story. Maggie was invited to visit the ward to see the improvements that had been made following receipt of her complaint and to speak with the staff who cared for her dad. This enabled Maggie to get answers to all the questions she had about her dad's experience and helped her to move on with her grief. Maggie praised the staff involved in the whole organisation for the commitment that was shown to learn from her family's experience in an open and honest way that included her. These lovely photographs show Maggie with her mum and dad when she qualified as a nurse, and one of her favourite photos of her father with their family. It's only by welcoming feedback that we can learn and improve. As a Trust, we're so grateful to Maggie for taking the time to point out where we fell short and to work with us to make improvements. And I'd like to thank Maggie as well for agreeing for her story to be shared with us tonight. So that concludes my welcome and introduction. And now I'd like to hand over to our lead and deputy lead governors, Andrew and Doreen, who will present the Council of Governors report.
Hi, I'm Andrew Moran, a Public Governor for the Liverpool City Region North and Lead Governor of the Trust's Council of Governors.
Hello, I'm Doreen Schlechter, a Public Governor for the Liverpool City Region South and Deputy Lead Governor here at Liverpool University Hospitals.
I want to start by telling you a bit about our Council of Governors, which is made up of 31 governors who represent the views of our members, staff and key stakeholders. We have 16 public governors, which include 7 governors representing the north of the Liverpool City region, 7 governors representing the interests of members in the south of the city, and 2 governors who represent those members who live in the northwest of England and North Wales. All our public governors are elected by our membership to act in the best interests of our members and the public. We also have 8 staff governors who are elected by our staff membership. There are 2 governors in each constituency covering medical practitioners and dentists, nursing, allied health professionals, scientists and technicians, and other non-clinical staff. Finally, we have 7 appointed governors who voice the interests of our key stakeholders. These include the University of Liverpool, Liverpool John Moores University and Edge Hill University, as well as local authority representation from Liverpool, Knowsley and Sefton councils, and an appointed governor from the voluntary sector, YPAS, to represent the views of children and young adults.
Being a foundation trust, you as our members elect or appoint us as governors, and we are accountable to you. The governors nominate and appoint the non-executive directors who are accountable to the governors, and finally the non-executive directors appoint the executive directors who are held to account by the non-executive directors. Governors have a number of statutory duties which include the appointment of non-executive directors and holding them to account, receiving the Foundation Trust's annual report and accounts, and most importantly, representing the interests of Trust members and the public. We're going to talk you through how your Council of Governors discharged their statutory duties during the most recent financial year and what this means for our membership.
In 2020-21, the Council of Governors completed its first full year as the Council of Governors for Liverpool University Hospitals. Following the merger of Aintree University Hospitals NHS Foundation Trust and the Royal Liverpool and Broad Green University Hospital NHS Trust back in October 2019. This was a challenging year. As a result of the global pandemic, and as a Council of Governors, we continued working in a mostly virtual environment, with the best interests of our local community at heart. Despite those challenges, we contributed significantly to the work of the Trust. Here is a list of those achievements, from which you can see that in 2020-21, the Council of Governors approved the reappointment of the Lead and Deputy Lead Governor of the Trust, meaning that we retained a strong degree of consistency as we further developed as a new trust. We also developed and implemented the Governor Code of Conduct and further revised our Governor Handbook. In combination with holding a virtual Governors Development Day, we continue to make sure that all our governors continually behave in a way that puts our members and the public at the forefront of what we do. We undertook a Council of Governors effectiveness review, which contributed to the development of a more robust cycle of business for the current 2021-22 financial year, which is helping us to more effectively discharge our duties. And a review of the Nominations and Remunerations Committee terms of reference was carried out so that we can continue to act with confidence when appointing to non-executive director posts and other board level positions. We also held a virtual annual members meeting, which gave us the opportunity to engage with our members and provide them with information on our role during the journey towards our trust merger. That meeting is, like today, where the annual report and accounts are presented, which have been subjected to rigorous review by the Council of Governors before being laid before Parliament.
During 2021, the Council of Governors established the Membership and Engagement Committee, whose primary duty is to support the governors in fulfilling their statutory responsibility of representing the interest of trust members. This was done through developing recruitment and engagement activities in line with the Membership and Engagement Strategy, which is available on the Trust website. To monitor progress against the strategy, we introduced the implementation plan that is being worked through during 21-22 and includes our governors attending virtual volunteer and staff inductions throughout 2021 to encourage member uptake. We updated the Trust induction presentation to emphasize how important it is that our members shape the activity and services of the Trust. The Council of Governors also fulfilled their responsibility for holding the Trust Board to account by playing a pivotal role in approving the performance outcomes of the Chair and non-executive directors for 1920 through their contribution to the appraisal process. The Governors also played a key role in the appointment of 2 non-executive directors during the financial year. Eustace de Souza and Sheila Samuels were appointed following a robust process which included stakeholder sessions with representation from the wider Council of Governors and Trust senior management, which fed into the interviews conducted by the Nomination and Remuneration Committee. which holds 3 governors within its membership. Monthly coffee mornings were introduced during 2021 so that the governors have a regular forum for raising member issues and finding out about the work of the Trust in an informal setting with the chair and non-executive directors. This approach has helped build stronger relationships between the governors and members of the Trust Board, meaning the governors are better placed to discharge their duties.
As you can see, the Council of Governors undertook a great deal of work in order to fulfil its statutory responsibilities during 2020-21, and we are continuing to do so during the current financial year, focusing on member engagement, reinstating in-person responsibilities, and raising the profile of governors and the Trust. On a final note, you, our members, will soon be contacted and asked to vote in the governor elections for 2021-22. The role of the governors is key to ensuring that the views of our members are spread up and out across the Trust to inform the decisions made by the Trust Board and within individual services. So we want to make sure that you feel you have the best people representing you on the Council of Governors, and voting in the governor elections is the only way to do this.
We will be seeking votes for a total of 10 seats. There are 7 public seats made up of 3 in the north and 4 in the south of the city. We will also be seeking votes for 3 staff governor positions, 1 in each of the constituencies for allied health professionals, scientists and technicians, medical practitioners and dentists, and other non-clinical staff. Your votes will matter in making the Council of Governors as representative as it can be of our local population.
If you want to get in touch with the governors or learn more about the Trust, further information is available on the Trust website. Thank you for taking the time today to gain a better understanding of the work of the Council of Governors throughout 2020-21.
Thank you very much, Andrew and Doreen, for explaining so clearly the vital role that our governors and members have played this year in supporting the Trust. You've done a great job, so thank you for that. I'd like to move on now to present a brief summary of our year in review. Without question, the pandemic has been the most significant feature of the last year, affecting every aspect of our performance and operations, and of course having a profound impact on all of us, every member of staff, every patient, every member of the public. Our city experienced 3 significant waves of COVID-19, with peaks of inpatient numbers occurring on the 1st of April 2020, the 8th of October 2020, and the 5th of January 2021, when we had 571 inpatients at that point. During October 2020, we had one of the highest rates of COVID-19 infection of any city in Europe. Obviously, the pandemic required us to shift our focus and resources away from business as usual to respond to this crisis and to meet the needs of so many seriously unwell people in such significant numbers. As one of the few trusts in the country with a high consequence infectious diseases service, our colleagues were some of the first NHS staff to care for COVID-19 positive patients. Our team of infectious diseases experts were key in advising the country's initial response to the pandemic, including providing expert advice and assistance to Arrow Park Hospital's quarantine centre, which received repatriated British citizens from Wuhan and Japan. These were very frightening times for all of us, and we are so proud of all of our staff who responded with amazing courage and commitment to care for over 5,000 patients in incredibly difficult circumstances. Despite the darkness of the pandemic, there were some really significant bright spots of innovation and collaboration. Liverpool demonstrated unparalleled community spirit solidarity, and civic pride throughout this period, and the Trust was proud to be a key player on several key developments. One of those was around COVID-19 related research. Our Trust delivered 48 COVID studies. We were the lead NHS site for the Agile COVID-19 study, which focused on developing new treatments for patients, and we were the single biggest recruiter for the trials that were so key to developing the Oxford AstraZeneca vaccine. We also played a vital role in supporting the mass testing pilot in Liverpool that started in November 2020. Subsequent evaluations have shown that over half of the population of Liverpool took part in that testing, resulting in an estimated reduction of 21% of cases up to mid-December. That was a period before vaccines were available. Over this period, we've over 385,000 COVID-19 tests have been processed by our laboratory teams. And there have also been innovations in patient care. These included the redesign of CPAP, or continuous positive airway pressure, meaning many more patients were able to be nursed on wards outside of intensive care and without invasive ventilation. Many of our outpatient clinics were able to continue virtually, giving continuity and access. And very critically, we were able to launch a virtual visiting service for inpatients, connecting them to their families and loved ones when visiting in person was not an option. Staff in our vaccine hubs on the Royal and the Aintree sites did an outstanding job of deploying the vaccine to our own staff, to other healthcare workers in the city, and to priority individuals as soon as the Pfizer vaccine was made available. Subsequently, Trust staff continued to help pop-up and community initiatives to provide access to the vaccine for all throughout the city. In general, there was a great spirit of collaboration and mutual aid among all of our partners in the city region, with universities supplying significant numbers of student nurses and doctors to work in our wards, with specialist trusts including Liverpool Heart and Chest, Liverpool Women's, Clatterbridge, and the Walton Centre, all providing practical help, and with us receiving outstanding partnership support from local authorities and Merseycare, our mental health and community provider in particular. The pandemic required us to work differently and put pressure on all of our services, creating longer waiting times than anyone would wish to see. There has been particular pressure on urgent and emergency care and on waits for elective care for many patients. Our staff did a remarkable job of continuing to meet COVID-related demand, to recover activity in elective services, and to continue to prioritise patients on the waiting list on the basis of clinical need. We really regret that we were not always able to offer rapid access or the best patient experience throughout this time of unprecedented demand and complexity. Some of our patient satisfaction statistics, particularly those related to our emergency departments, reflect this, although we are pleased that so many of our patients said that they would recommend our services. And from the numbers on this slide, you can see how busy the year was, with tens of thousands of attendances, procedures, and appointments completed. Despite the pandemic, we were also successful in developing our strategy as a new organisation. Early in 2021, our Future Together, the first 3-year corporate strategy for Liverpool University Hospitals, was launched. The strategic framework guiding our priorities and goals was developed by the board in consultation with staff, governors, and stakeholders. Our strategy emphasised the need to work together within our hospitals, with our partners, and with our communities to achieve our ambitious programme. Importantly, through a broad engagement process, the Trust's values were set and continue to form the basis for the culture we seek to embed. And finally, I wanted to reiterate the importance of togetherness throughout the year. Mutual aid and partnership working were such an important feature of our activity. Earlier in my presentation, I described the Trust's successes in COVID-19 research and in contributing to the development of new treatments and clinical trials, including those to develop the AstraZeneca Oxford vaccine. We're now a partner organisation in the city's new Global Pandemic Institute, which will deliver pioneering research and great preparation for future pandemics. I also described the extensive mutual aid and close partnership working that characterised the year. This activity resulted in the implementation of a very successful winter plan with excellent collaboration between the Trust, Merseycare and adult social care services. This partnership working also provided the foundation for the creation of additional step-down and rehabilitation capacity at Stoddart House on the Aintree site for local people who are discharged from our acute wards but still need reablement support before returning home. Through the incredible generosity of the public and corporate donors, we received overwhelming support to our hospital charity last year. At the start of the pandemic, we launched our Support Our Staff appeal, which raised nearly £250,000 in local donations. We were also significant beneficiaries from Captain Tom's heroic fundraising efforts and from the NHS Charities Together COVID-19 appeal, which awarded our charity over £500,000. These donations enabled our charity to support a number of initiatives to make life a bit easier for our staff and patients. Wellbeing hubs were created at each hospital site to provide staff with a well-equipped and relaxing rest area to take a break during prolonged and intense shifts. Recreational items such as televisions, radios and puzzle books were purchased for inpatients to help them pass the time. And wards were supplied with brand new nightwear and toiletries for inpatients. And these little touches were particularly important at a time when visiting wasn't a possibility. Smart technology devices like iPads were distributed to support our virtual visiting initiative. As I mentioned, our staff responded to the challenges of COVID in a simply amazing way, with individuals demonstrating incredible courage, commitment and teamwork. However, this has come at a cost, and over the last year, the Trust's mental health support team received an overwhelming number of staff referrals at a rate and a number far higher than our normal capacity could address. With work and home life pressures becoming overwhelming for many of our staff, we recognise the urgent need to meet the demand for psychological support, and charitable funding was a great help and a lifeline in enabling the expansion of this service and the training of mental health first aiders to care for staff who in turn cared for patients. That concludes my review of the year. Thank you very much for listening. I'll hand over now to our Interim Chief Executive, Sir David Dalton, who joined us just at the start of this month to provide a forward view.
Just committing the cardinal sin there of being on mute, so please forgive me. But I'm delighted to be joining you as your interim chief executive. And although I've not been at the Trust for the past year, it's very clear by looking at the Our Future Together strategy that the four greats have been demonstrated during the ongoing pandemic. And to remind you, our four greats are great care, great people, great research and great ambition. Over the next 6 months, I will be working with all of the staff in the Trust to support them in providing great care. Now, unfortunately, sometimes not everything goes as we would wish. And I think it is important that we acknowledge the comments that have been made by the Care Quality Commission, CQC. And we will be working very hard to understand the systems and processes that have let people down, and we will work equally hard to find solutions to put them right. Because we have a huge commitment to provide great care, and to do this with the community spirit in the city and through our teamwork. It's really what unites all the colleagues here at Liverpool University Hospitals. So let's look into the future now. The people of Liverpool and beyond deserve healthcare that is provided to the highest standard, and everybody who works for the Trust needs to feel that they are being supported to provide that great care. Now, I've agreed with the board that we should focus on 3 fundamental priorities during my period as Chief Executive, and these are the Trust's purpose, its people, and its partners. Now, for the purpose, what I mean by this is to recognise the Trust's overarching purpose is to deliver outstanding healthcare, which is safe, effective, and caring. And I'm delighted that we are launching a new approach to quality improvement with its focus on patient safety, which should help staff feel supported to provide that outstanding care. The second priority is people. And we recognise that the Trust's ambition and its plans can only be delivered by the commitment of the people who work for it. And I know that all of my colleagues share a view that people will give of their best if they feel that they're genuinely involved and supported, and if leaders listen to them and understand the impediments that can sometimes get in the way of providing great care. And I and my leadership colleagues will commit themselves and are committing ourselves to be supporting staff throughout the whole organisation to achieve this. We have many partners in Liverpool, and we believe that it will be stronger if we all act together. And I will be doing my very best to work with our partners in our NHS Trust, in our City Council, in our CCG, to unite us in finding ways of making the care in Liverpool to be as good as it possibly can be. So let's have a look at great care. And I've mentioned that we are working now to create the best safety culture in the NHS. And this is a culture where the safety of our patients, their relatives, and our staff are our foremost priority, where they feel genuinely cared for, safe, and confident in speaking up, and know that their concerns will be responded to. And to achieve this, we're focused on delivering safe, caring, and effective healthcare, and striving to provide a great experience for all of our patients. In our role as an anchor institution that our chair has just outlined, we recognise the wider influence that we have in our city region, and we take our responsibilities very seriously. And this year we've been setting out our plans to become a sustainable, valued and innovative partner so that we can progress our clinical service integration and our collaboration with health system partners. And we look forward to being able to report future achievements that should have a great impact on the lives of our communities. Now, at Liverpool University Hospitals, we want to ensure that we provide a great experience for our staff, for our people who work with us. Often said, I know that people are our biggest asset, and they are, and we value the contribution that they make to ensure that we can provide outstanding healthcare. We want to be the employer that people want to choose to work with, and we want to support them and help them to develop their career in this organisation. And we value the contribution that they make to delivering our priorities, and we will support them because our success depends upon their contribution. For example, the Trust Board has agreed an additional investment of over £1.5 million, which is enabling 12 additional doctors to provide support in our emergency departments. And I expect this will be the first of many changes that we will be able to report that will have a beneficial impact on our clinical teams and other staff. And I'm also really pleased to announce that we have welcomed our newly qualified nurses this month who have joined the Trust. Now, to become an outstanding centre for research and innovation, we will continue to grow our existing portfolio of high quality research and innovation constructed around the healthcare needs of our local population, and we'll be actively involving our patients in research opportunities as part of their routine clinical care. We hope that by doing this, we can work to address health inequalities and really embed a culture of research and innovation across the whole organisation. A key element to the Trust's exciting future is the completion of the new Royal Liverpool University Hospital. This is long awaited, I know, but work continues at a pace so that we will be able to welcome our first patients into a wonderful new building about this time next year in late summer of 2022. This state-of-the-art hospital will be one of the biggest in the country to provide inpatients with 100% single ensuite bathrooms. It will provide privacy and greater dignity for our patients. It will reduce the noise that's often heard in our wards, reducing disturbance, and single rooms, we hope, will improve the patient experience and support them to their faster recovery. We also expect that the layout and the design of our new hospital will improve patient safety by enhancing our ability to safely manage people with infections and reduce the risk of medicines errors. But this isn't all that the Trust is investing in. This year, £22.5 million is being spent on a programme of improvements, enabling the refurbishment of Aintree University Hospital's main entrance, and work is currently ongoing to upgrade the tower block and make emergency department improvements. This is the biggest single investment in Aintree's tower block, and it will extend its lifespan by over 30 years. So I hope I have been able to describe our commitment to providing great care, to support great people, to undertake great research, and to continue with our great ambitions. Thank you.
Thank you very much for that, David. Now we're going to move on to our question and answer section for the meeting. We received a number of questions in advance of the meeting, and I'd like to thank those of you who took the time to send us through your thoughts and questions before joining us tonight. So I'll go through and read out the question and indicate who will be giving the response. So the first question is for David Dalton. When will the new Royal Liverpool University Hospital building be open?
Thank you. We're making really good progress, and we're expecting the hospital building to be handed over to the Trust by Lang O'Rourke in the spring of next year. We are well advanced in our plans to enable clinical services to move into the building, but we will need a period of time to allow us to equip the building, to furnish it, and also to make sure that staff are familiar with the layout and the design. And that means that we expect to be ready in the late summer or early autumn next year. I think by about this time next year, we will be receiving our first patients in that wonderful new hospital.
Thank you. And the next question I'm going to field. So the question was, what was the thought process behind the significant pay increase awarded to the Chief People Officer in the year 2019-20? The pay for staff at Executive Director level, including the Chief People Officer, is determined by the board's Nomination and Remuneration Committee, which comprises the non-executive directors on the board. Details of pay relating to executive directors and non-executive directors is contained in the Trust's annual report, which on pages 38 to 40 sets out the levels paid during 2021 and 2019-20. The Trust's Nominations and Remuneration Committee considers each of the proposed salaries for executive directors at the time of their appointment and undertakes regular reviews, which takes into consideration performance information against key objectives together with national benchmarking information. And this enables the committee to compare pay levels with peer NHS trusts. The review during 2021 resulted in a small increase in line with the individual's performance. There was not a significant pay increase for the Chief People Officer during the reporting year. The Trust's annual report on page 40 explains that the salary and fees for 2019-20 related to a 6-month period, which was the 1st of October 2019 at the point of the new trust being created to the end of the financial year, the 31st of March 2020. And the salary and fees for 2020-21 relate to a full 12-month period. Okay, the next question is for Rob Forster, who's our Chief Finance Officer. Why was money directed into non-healthcare establishments during the pandemic when it would surely have been better utilised to support the NHS?
Thanks, Sue. Yeah, the Trust can't comment on government spending policy made during 2021. However, Luft, as with every other NHS organisation, were supported for specific COVID-19 response expenditure. And in the year ending 30th of March 2021, this actually totaled £69 million.
Thank you. Next question is for Colin Hunt, our Deputy Chief Nurse. And the question is, will suitable notice be given to volunteers in advance of their return to work at Luft so that they can be allocated and gain familiarity with new work areas?
Thanks, Sue. Yes, our volunteer service have been supporting volunteers throughout the pandemic by checking in on the welfare and providing updates on our plans for reintroducing volunteers across all of our sites. We've introduced volunteers on a phased approach, starting with non-clinical areas such as meet and greet and supporting our personal protective equipment stations, the PPE stations. Risk assessments have been conducted for every volunteer role and with each individual volunteer. And a bespoke training programme has been developed for volunteers returning back onto the site with a full local induction programme, which is mandated before a volunteer returns to a role or starts in a new role. Due to individual circumstances, we also acknowledge that some of our volunteers do not feel ready currently to return to our sites, and we continue to support them and keep them updated of all of our plans. But finally, I'd just like to say a massive thanks to our volunteers for the amazing contribution that they've made in the past year and the support they've provided. Thanks very much.
Thanks, Colin. The next two questions are for Rob, again on medicine costs. So the first one is, what does or could Luft do to minimise the impact of the rising cost of medicines on the Trust's financial position?
Okay, thanks, Sue. Yeah, the Trust has a very active pharmacy department, and the department do assess the most appropriate and value for money medicines that we use within the services we offer. These assessments enable the trust to maximise value for money, and they include looking at changes in contract arrangements, general product purchasing reviews, reducing duplicate supplies, and changing practice of prescribing. There's also attention paid on a rolling basis to medicines that come off patent, and over the past year this has enabled us to save circa £500,000, which has been put towards frontline services. Thank you.
Thanks, Rob. And the second question is Luft part of any collaborative initiatives with the government to ensure robust funding arrangements for medicines going forward?
Thanks, Sue. Yes, the Trust is part of a number of collaborative arrangements. We are active members of the Cheshire and Merseyside Collaboration at Scale Board, which is a board that looks at how organisations can collaborate to reduce the overall cost of delivering services. In terms of medicine specifically, the Trust is an active member of the Regional Pharmacy Group, which reviews and advises on medicine strategies, contracts and logistical supplies of medicines. This group feeds up into national committees in support of the wider management of medicines, and the Trust is signed up to the regional contracting and purchasing framework to ensure that we take advantage of the best prices available for drug supply. Thank you.
Okay, thank you. Thank you. And the next question is back to you, David. How important does the Interim Chief Executive consider it to be that patient complaints are responded to by the deadline set by the Trust on receipt of the complaint?
Thank you, Sue. I think it's really important that if anybody has a comment or a complaint about the service or the experience that they've received at the Trust, that they get a speedy resolution to that complaint. And we've got timescales that we are obliged to follow. I think, if I may, what is for me the most important issue is that we investigate that complaint thoroughly. We put ourselves in the shoes of the person who's written to us or commented to us, and we thoroughly understand what it is that they would like us to consider, and that we tell them honestly and in a straightforward way what the results of our investigations have found, and we do that whatever those results are, and we should let complainants know if we've done something that we shouldn't have done or made an error. We should be straightforward and we should be honest with them. Occasionally we do not meet our deadlines, and that's been particularly the case over the COVID pandemic period. We've been concerned about this. We do have a backlog at the moment of about 50 complaints which have gone on an extended time period. Our team are making the best endeavours they can to reduce that backlog, and I've been talking with them about what extra support they can have. When we don't meet the deadline, our expectation is very clear, and that is that we will talk to the complainant and agree with them an appropriate extended deadline. So I hope I've responded to that question, Sue.
Thank you. The next two questions are for Paul Fitzsimmons, our Deputy Medical Director, regarding gastroenterology. So the first question is, as a result of the procurement exercise, some gastroenterology patient care is now being delivered in Manchester, impacting patient experience in the existing Luft service. Who is the most appropriate member of staff for this issue to be discussed with in order to understand the longer term implications?
The only care within gastroenterology that is now being delivered in Manchester is the intestinal failure service. This arrangement is a result of Salford Royal NHS Foundation Trust being awarded the intestinal failure service across the northwest of England following a successful bid through commissioners. As a result of this commissioning arrangement, the intestinal failure service is now being provided by Salford Royal rather than in Liverpool. It's recognised that patients on this pathway will be required to travel to Salford to continue their care, including patients who might be acutely unwell. The members of the gastroenterology team most closely involved with this service are Dr. Martin Dibb, the clinical lead, Alison Young, the nursing lead, and Julie Batterton, the operational lead for this service.
Thank you. And the second question is, what action is to be taken to address the immediate issues experienced within the gastroenterology department as a result of outsourcing some intestinal failure care services to Salford, and in the longer term, the potential effect on the trust in terms of its ambitions for the region?
There are no plans to outsource services to Salford. The commissioning process awarded the intestinal failure service for the northwest of England to the Salford Royal NHS Foundation Trust. The trust did put forward a bid to be the intestinal failure service at that time, but we were unsuccessful. It is recognised that the intestinal failure service being delivered regionally could mean that the gastroenterology department in Liverpool could experience challenges with recruitment and retention of specialist teams who have a specific interest in this field. Current advertisements for locum and substantive consultants are out to advert in order to support the consultant workforce in gastroenterology. For our home parenteral nutritional service patients, there is still a hope that Liverpool can continue to provide this service, and there is currently a community team in place to aid with the delivery of this. As an action to address this, the service leads from the Trust will continue to work with colleagues from NHS England and Salford. Such discussions with Salford and commissioners will also include the potential impact on the Trust's future ambitions, particularly specialist cancer work in the new Royal Liverpool Hospital, which would require a degree of intestinal failure cover within the organisation. The issue will continue to be raised within the organisation at senior executive forums to ensure visibility of the challenges faced as a result of the commissioning decision.
Thank you very much. Okay, and thank you to all of those who submitted questions in advance of the meeting. We'll now move on to those questions that have been posted into the chat session during the meeting. So I think the first two are, sorry, I beg your pardon. Yes, the first two are for David. First one, what are you doing in relation to the latest CQC inspection?
Thank you, Sue. And CQC is the Care Quality Commission, and many on the call may know that the Trust had an unannounced visit and an inspection over June and July. They were focused on looking at our core services in the surgical and medical wards in our operating theatres and also in our emergency departments. And they reviewed those services on both the Royal site and the Aintree site. And we anticipate that they will be publishing their reports later next month. I think it's really important to understand that CQC and the feedback that they provided to us in advance of their report noted that our staff treated patients with kindness and compassion, and they were at all times caring towards them. And I'd just like to emphasise that in my short time in visiting wards and departments in the Trust, I've also experienced that and can see how proud the board should be of our staff and the resilience that they've shown over the last 18 months. Unfortunately, though, the CQC did identify a number of concerns related to patient safety, and these were mainly focused in our emergency departments. And they were concerned about issues of overcrowding and the pressure on the department with patients experiencing lengthy delays when they attended those emergency departments. Now, as a consequence, the CQC can provide under Section 31 of the Health and Social Care Act a notice which imposes conditions on the trust, and this is what they did, requiring us to provide regular monthly updates on how we're able to demonstrate improvement in the areas where they found shortcomings, particularly in our emergency pathways, and how we can satisfy them that at all times we are keeping our patients safe during those very pressurized times when there is huge demand in our emergency departments. So first and foremost, we've taken that action to address those immediate safety concerns, and with the huge support of our staff, we're finding new ways to minimise the risk of harm in our emergency departments, and they have identified with us changes that they have now introduced, such as having a dashboard available to them at all times, monitoring the patients within the department, giving them information about the live flow, that is when patients are ready to be moved from the emergency department to another area or are ready for transfer or discharge. They've also introduced what I think is a very important development, which is a round of every patient who is within the department, so nurses, other clinical staff will be alongside a patient, making sure all of their needs are understood and addressed, and making sure that any signs of deterioration are spotted before they actually occur. So we now have a new improvement programme, and we're confident that that is going to be supporting staff to deliver safe and reliable care in our emergency departments. And the other areas that CQC have commented on are going to form a wider but single improvement plan across the trust.
Thank you. And a linked question, when will the trust receive its CQC rating?
We don't actually know a precise date. We're anticipating that the final report will be available and published next month, but I'm unable to give you a firm date. But as soon as they have confirmed the content, then it will be made available and will be made publicly available.
Thank you. The next question I'll field. The question is, so David Dalton has been appointed for 6 months only. Has somebody a substantive chief executive has not yet been appointed, and we hope to have the arrangements for that process confirmed shortly. The process will be clear and it will be compliant with the governance arrangements as they're set out in the Trust's constitution, and it will meet the requirements of our regulators. So this means that the decision will be reached by the board's Nominations and Remuneration Committee with input from independent assessors, regulators, partner organisations and internal stakeholders, including our staff, governors and clinical leaders. There will be a number of assessment points as part of the process that provide extensive information for the committee to review as it's making its decision. And certainly the process that will be undertaken will be considered by the Council of Governors to provide assurance that all the necessary steps have been taken. And I would emphasise that the Chief Executive role on a substantive basis will be subject to open competition We will be engaging a search organisation to ensure that the widest possible pool of potential applicants is reached, and we will be seeking an outstanding candidate who lives the Trust's values, who matches the level of the board's ambition as we've set it out in our strategy, Our Future Together, and someone who really embraces the opportunity to provide dynamic leadership and to work with our partners collaboratively across the city region. The next question is for Colin Hunt. When will visiting be reintroduced across the sites?
Thanks, Sue. So the Trust are currently observing national and regional guidance on restricted visiting during the pandemic, which has been in for some time now. However, we are very cognizant of the distress that this is causing to patients and their loved ones, particularly as other restrictions are lifted out in the community. As such, the organisation were keen to relax some of the limitations on visiting as soon as possible, and plans to increase visiting are currently being considered by the Director of Infection Prevention Control, as well as the executive team. And although there's currently no date for this, we hope to be able to provide an update shortly. A proposal is going to the Executive Oversight Group at the end of this week to consider, and I will ensure that any update in terms of visiting arrangements will be communicated widely as they are agreed.
Thanks very much, Colin. And our final question is for Debbie Herring, our Chief People Officer. The question is, are you concerned about the news that a lot of nurses are thinking of leaving due to exhaustion?
Thanks, Sue. Yes, we are concerned. We know it's been a really difficult 18 months for our nurses. And I think this is the same across the whole of the country, but we feel that our nurses have had a particularly hard time because of the number of COVID patients that we've had in and the disruptions to service, and the fact that we have been making a lot of demands on our staff in terms of asking them to move to other areas where there was more demand, and to sometimes to change their hours and patterns of working as well. And we really do appreciate everything that everybody has done. We have tried to increase and offer as much support in terms of staff wellbeing and health initiatives and support, psychological support for staff as well. And we are also looking at our recruitment and retention and looking at what can we do to keep people. We know the pension changes are happening at the end of next March as well, and that we've got a number of nurses who perhaps are coming up towards retirement age and who may be thinking now of going because of the impact that COVID has had on their working lives. And so we're very conscious of it, and we're trying to do everything we can to offer more flexibility, to try to look after our staff during these really difficult, challenging times, and to make sure people do feel supported and that they have adequate rest and recuperation as well. But yeah, we're very concerned about it, and it is one of our major risks, as I'm sure it is in most acute trusts. Thank you.
Thanks very much, Debbie. So that was the final question that we received. Thank you very much to all those who either sent in a question earlier or posted one during the meeting. We really appreciate your interest. So it just remains for me to say thank you so much for joining us, taking the time to express interest in the Trust. We were hoping to convey a flavour of what last year held for us, and also to set the scene for our priorities and activities for the future. We clearly have a lot to do, but it is a very exciting future ahead of us. And I just wanted to reiterate that on behalf of everybody on the board and in the Trust, we're totally committed to achieving our vision of healthier, happier, fairer lives for the people we are so privileged to serve. So thank you again for joining us. Please do continue to support us as we take our next steps